What the complications related to diabetes are. Whereas HHS is a condition which is mostly seen in type 2 diabetes. Chronic complications of diabetes. Hello, my name is Dr. Ganavi. I'm working as Associate Professor and Consultant Endocrinologist at Ramaya Medical College and Ramaya Memorial Hospital. So in today's session, we'll be talking about what the complications related to diabetes are. So the complications related to diabetes can be divided into acute complications or chronic complications. Acute complications are the complications by which the patients can present to the emergency department as well. So the most important acute complications related to diabetes are the diabetic ketoacidosis and the HHS, known as the hyperglycemic hyperosmolar state. So the other acute complication related to diabetes are the infections. So the first complication, that is diabetic ketoacidosis, is a state where there is insulin deficiency, because of which the blood glucose tends to go to a very great extent, because of which there can be urine ketones positive, and this condition usually patients present with profound dehydration, for which the patient will require an ICU admission. So in this condition, we usually give the insulin in a drip manner. This is called as the insulin infusion, and we monitor the blood glucose regularly on an hourly basis. And in this condition, there can be a lot of electrolyte disturbances. The sodium and the potassium disturbances can be usually found in this condition. So correction of these electrolyte disturbances is also very, very important. So apart from this condition, the other condition known as the HHS can also present with dehydration, but the dehydration in HHS is going to be much more severe than in diabetic ketoacidosis. Diabetic ketoacidosis is one of the very common complication of type 1 diabetes, and many children usually get admitted with this condition if the blood glucose is not under control. So whereas HHS is a condition which is mostly seen in type 2 diabetes. So in this condition, especially the elderly individuals, they present with profound dehydration, and because of which they be in a stupidous state or a comatose state, and also sometimes mild subtle orientation defects can also be present in this condition. So again, if the patient has a lot of excessive urination, if the patient you feel that the patient is dehydrated, so consulting the doctor immediately is very, very important. So again, in this condition, we usually admit the patients in the ICU, and again the mainstay of treatment is the correction of dehydration along with the insulin infusion, which helps in controlling the blood glucose levels. So the next important acute complication of diabetes is the infection. Sometimes patient can present with severe life-threatening infections called as rhinocerebral mucormycosis. There are other conditions called as the malignant otitis externa, or whereas there is severe ear infection, and these two, the other condition which I said earlier, can result in nose and ear infection, and the infection can be also transmitted to the brain as well. So that is about one of the most severe complication, that is the infections related to diabetes. The other infections related to diabetes are the Fournier's gangrene, where there can be infections of the scrotal skin, and the genital infection as well. So the other infection is the necrotizing fasciitis, where there is infection of the subcutaneous tissue, which can spread to a great extent and very rapidly, which might require sometimes amputation as well. So to prevent all these conditions, definitely keeping the blood glucose under control is very, very important. So the other complications are the emphysematus cholecystitis, that is the gallbladder infection, are also very common. So all these are the life-threatening infections. But apart from this, other complications such as recurrent urinary tract infection, recurrent gum infection, recurrent dental caries, and recurrent pneumonias again should raise a suspicion that the blood glucose is not under control, and hence checking the blood glucose in a timely manner is very, very important. So that is about the acute complications of diabetes. So now let's go to the chronic complications of diabetes. So chronic complications of diabetes can be again divided into the microvascular complications or the macrovascular complications. So the microvascular complications are conditions where the blood vessels are involved, which are of a smaller caliber. So the most important being the diabetic retinopathy, nephropathy and the neuropathy. And also autonomic nervous system dysfunction can also be a part of this. So diabetic nephropathy is a condition where the kidneys are involved, because of which the patients can present with swelling of the legs, sometimes the patient present with facial puffiness as well, and sometimes they present with increased blood pressure levels as well. So again, if the blood pressure is not being controlled and if you have any of these symptoms along with frothing of the urine, again consulting the doctor is very, very important, along with monitoring of your kidney functions. So the other chronic complication of diabetes is the diabetic neuropathy. So patients usually in diabetic neuropathy, the peripheral nerves are involved, because of which the most common symptoms are the tingling, burning sensation of the extremities. They can also present with numbness, and sometimes and also sometimes patient present with lack of sensation as well for hot and cold. So because of which we see a lot of patients who come with burn injuries, sometimes they go to the temple or other places barefoot, which can result in the formation of blisters or wound which is not even being recognized by the patient, and hence they present with an ulcer of the leg, which can sometimes turn into gangrene and would sometimes require amputation as well. So that is about the diabetic peripheral neuropathy. So sometimes patients also present with autonomic nervous system dysfunction in the form of giddiness while standing upright from the sitting position, a postprandial fullness, erectile dysfunction. So all these are complications related to diabetes as well. So if you have any of these symptoms, taking blood glucose, monitoring your blood glucose levels, and along with that consulting your doctor is very, very important. So the other chronic complication related to diabetes, as I said, that is the macrovascular complication, is mainly the complications related to the blood vessels of a larger caliber. So the blood vessels supplying the heart, the brain, and the blood vessels supplying the legs are the ones which are usually involved. So if at all, if there are cholesterol depositions within the blood vessels supplying the brain, this can result in stroke. It can also result in what is called as a TIA, that is the transient ischemic attack, so in which the patient just present transiently with blurring of vision, just mild slurring of speech or weakness of the limbs happening only for a short time. So, but if any of these symptoms are present, again consulting the doctor immediately is very, very important. So the other complication is related to the heart. So if the blood supply to the heart decreases, so usually patient present with chest pain. But in diabetes, sometimes the patient might not present with chest pain at all. They might just present with pain of the jaws, pain of the pain radiating to the left upper limb, and sometimes they can just present with excessive tiredness as well. So again, if at all, if any of these symptoms are present, taking an ECG, consulting the doctors, getting the appropriate blood tests is very, very important. So the other complication involving the blood vessels of the legs is called the peripheral arterial disease, wherein if at all, if the blood supply to the lower limb decreases, so patients usually present with pain of the calf region when they walk for a short distance. So again, recognizing this is important, because again this can result in gangrene. So this is about the complications related to diabetes. Acute complications being diabetic ketoacidosis, HHS, that is hyperglycemic hyperosmolar state. Both these conditions present with dehydrations and very high blood glucose levels, or infections which can be recurrent or can be sometimes life-threatening as well. And the chronic complications, that is the macro and the microvascular complications. So the next important microvascular complications related to diabetes is the diabetic retinopathy. So usually patients with this condition present with blurring of vision, or they can sometimes present with floaters or flashes of light as well. So sometimes patient present with diabetes can present with premature cataract as well. So again, if any of these symptoms are present, that is blurring of vision, floaters, flashes of light, or sometimes if there is severe pain in the eye, or if there is loss of vision, consulting the doctor immediately is very, very important.